everyone. This is Vamshi Krishna. So in this video you will see some of the basic questions for the upcoming staff nurse recruitment examination, mainly for the aims NORCET and Telangana MHSRB examinations. So the first question is, which drug can be given in the case of diarrhea? So in the case of diarrhea, among these four options, which one we need to give to recover from the diarrhea and prevent the dehydration, okay, to maintain the homeostasis? So the options are cotrimoxazole, calcium, antibiotics, zinc. So the right one is option D, zinc. So we need to replace the zinc mineral in the body. So in the case of diarrhea, the patient will be lose zinc mineral in the motions, in the loose motions, stools. So the right one is option D, zinc. So the next question is most sensitive vaccine. So among these four options, which one is the most sensitive vaccine, heat sensitive vaccine? Options are MMR, polio, TT and Covaxin. So the right one is polio. So polio is the most heat sensitive vaccine and heat resistant vaccine is the TT. The next one is a silent killer of newborn baby. Options are jaundice, hypothermia, congenital heart disorders, protein energy malnutrition. So the right one is option B, hypothermia. So hypothermia is also known as a silent killer of newborn baby. The next one is in HIV positive patient, Mantox tuberculin test is positive when the scar is more than. So in the case of HIV positive patient, okay, the TB test is positive when the scar is more than. Scar is nothing but a bubble, okay, the scar where we can give the injection. Okay, here you can see the picture. So we are giving the tuberculin test. So here we can observe the scar, how much is distended. Okay, so this is a Mantox test. So the options are 5 mm, 7 mm, 11 mm, 15 mm. So the right one is option A, 5 mm. So 5 mm is a positive in the case of patient with HIV positive. So in the normal persons, the tuberculin test is positive when it is 10 mm. Okay, more than the 10 mm it is positive, and if it is 6 to 9 mm it is a doubtful. Okay, again we need to check, and if it is less than the 5 mm it is negative. Why? Because in the HIV patients, there we have the patients having the a resistance for the Mantox tuberculin antigen. So it is 5 mm is positive in the case of HIV. The next one is the ECG changes of patient with hyperkalemia. Kalemia is nothing but potassium. Sodium is a natremia. Okay, hyponatremia or hypernatremia is a sodium. Kalemia is a potassium. So the options are tall T wave, flat P wave, wide QRS complex, inverted T wave. So the right one is option D, inverted T wave. So inverted T wave we can see in the case of hyperkalemia. So the next one is a antidote for magnesium. Okay, MgSO4. Antidote for the MgSO4 is a calcium gluconate. The next one is Rorschach's ink blot test is a, so ink blot test, it is a psychiatric test. So what is the purpose of doing this test? That is Rorschach. Options are projective, subjective, both, or none. So the right one is projective. So this Rorschach test is can be used for the conjunction with other diagnostic tools. Okay, it is projective measure for the identify a person's state of mind. So in the picture, this is nothing but ink blot test. So by seeing this picture, some person is thinking that it is a butterfly. Okay, some person is thinking that it is a bat. Okay, bat is nothing but gabilam. And some person is thinking that it is a ghost. So based on this picture, we can identify the person's mind. Okay, psychiatric person mind, state of mind. So how he is receiving the picture, how he is receiving the situations. Okay, what is the fear, what is the cause of the person fear, depression, and false beliefs. So all this we can identify by the Rorschach's ink blot test. The right option is a projective. So projective is a type of Rorschach's ink blot test. The next one is the most common type of hallucination seen in patients with mental illness. So the options are gustatory hallucination, auditory hallucination, olfactory hallucination, visual hallucination. So the right one is option B. Auditory hallucination is common with mental illness. The next one is acute myeloid leukemia is diagnosed by. Options are X-ray, bone marrow aspiration, CT scan, MRI. So which one is the correct option for the acute myeloid leukemia diagnosis? So the right one is option B, bone marrow aspiration. So the bone marrow aspiration is nothing but the marrow which is present in the bone. Okay, so here we can see the marrow. So we need to collect by the a needle. Okay, that is bone marrow aspiration. So this is a syringe like structure. Okay, so they will aspirate the bone marrow to identify the myeloid leukemia. The next one is, which of the following is a malignant tumor of the bone? Options are fibrosarcoma, lipoma, this is lipoma, and osteogenic sarcoma. Option D is the osteoma. So the right one is option B. Osteogenic sarcoma is a malignant tumor of the bone. The next one is allogenic bone marrow aspiration means. So what is the meaning of allogenic bone marrow transplantation? Sorry, this is transplantation. Options are transplantation with the same person. So it means we need to collect from the patient, that is bone marrow, and after separation of the, after some procedure of the bone marrow, again we introduce into the same person. That is transplantation with the same person, within the same person. Option B is the transplantation of the, sorry I'm getting so the third option is from animal, transplantation from the animal. Option D is the inorganic material transplantation. So the right one is option B. Allogenic is from one person to another person. For example, he is the patient, he is a healthy person. So we need to collect the bone marrow from this person to the, and we are transplanting to the patient, okay, in the some blood disorders. The next one is Hodgkin lymphoma commonly involved in. Options are back, neck, chest, and groin. So the right one is the neck. So the back of the neck, it is commonly seen the Hodgkin lymphoma. The next question is the suction of the internal fluids of corpus and injection of embalming chemicals into the body cavities using an aspirator and trocar is a method of. So understand the question. So in this question, what they are asking, they remove the body fluids from the cavity and inject the some chemicals, that is embalming chemicals. So the options are surface embalming, cavity embalming, hypodermic embalming, arterial embalming. So what is the right one? Option B. So we will see the what is embalming. So embalming is nothing but, for example, if you take a dead body, okay, a dead body. So in order to preserve the dead body for the long days, so what they will do, they will inject the some of the chemicals, some chemicals. So that is, they will inject the chemicals into the cavities, cranium, thoracic, abdomen, and internal body structure like blood vessels and the cells and everything. That is nothing but embalming. Okay, embalming is nothing but injecting of the chemicals into the body. That is surface. Surface is nothing but skin, and cavities are cranium, thoracic, abdomen, and pelvic. And hypodermic is it is nothing but related to the skin structures, and arterial is blood vessels. Okay, so these are the types of surfaces. It is related to the skin, and hypodermic is under the skin, arterial is the blood vessels, cavities are nothing but cavities. So that is nothing but embalming. So the next question is varicose vein at anus is known as. Options are fissures, hemorrhoids, encopresis, incontinence. So the right one is hemorrhoids. So hemorrhoids are the blood are the structures we can find the a bulging of anal region. For example, if you think it is a anal region, so you can find the some bulging structures. So in these bulging structures we have the blood vessels. So actual hemorrhoid is nothing but it is consist of blood vessels. So why it has bulged extensively? Why? Because when you are going for the motion, if you keep more pressure on the anal region, what will happen? The blood vessel will be bulge like this. Okay, so it is nothing but hemorrhoid. The next one is a nurse preparing a patient with 45 years old for gastrectomy. So gastrectomy is nothing but removal of some part of the stomach. Okay, gastrectomy is nothing but removal of some part of the stomach. So the patient asked to the nurse about the possible complications of gastrectomy. So if you remove the stomach some part, what are all the complications will be there? So the patient having some doubt and he wants to clarification from the staff nurse. So which of the following responses by the nurse is appropriate? Options are: the patient may develop the dumping syndrome, or clay colored stool, ribbon like stool, or jaundice. So what may be the right answer? That is dumping syndrome. So dumping syndrome is nothing but it is like a when the patient is taking the food, immediately it goes to the duodenum, small intestine, so it feels like a empty stomach. Okay, so dumping syndrome is nothing but it is feeling of empty stomach. So this syndrome can be the complication of gastrectomy. The next one is what is the theme of World Health Day 2023? Present year theme of Health Day. Options are: our planet, our health, health for all, need nurse, healthy environment. So what may be the right one? Option B, health for all is the 2023. Our planet and our health is for the 2022 World Health theme. Okay, this is 2022 and this is 2023. So this is end of my class, guys. Thank you for watching my video.